Hi, I'm Dr. Nick, and I'm from Incremental Healthcare.
And I'm Fred Goldstein with Accountable Health.
And we're here to talk about COVID-19 and how it affects your employees.
So why don't we go ahead and get started, Nick, by you giving us an update from the medical perspective about what's happening with the virus.
Well, so there's lots going on. And, the one thing I would say is when you listen to this, it's got to be concurrent with the time of the information because things are moving very quickly. We have a real challenge keeping up. Here's what we know at this point in time. We haven't reached a peak in terms of infection in the US. We've shut things down to some degree. We have no treatments per se, although there's certainly some expectation of treatments to come. And we're exploring some that I think are kind of interesting to talk about. But our mainstay of prevention at this point is limiting contact, so social distancing or physical distance, and reducing the spread of the virus through the population.
So do you think, Nick, based on what we've seen in China, maybe Italy at the other extreme, or Singapore at a lower level and Italy at the other extreme, where are we in the United States? Do you feel we're early enough? Is it too late? How much of an impact do you think some of this is going to have?
I'd like to be the bearer of good news, but I feel like I can't be based on the signals that I see and certainly the information that I'm reading and what I learn from others who are more expert than I think we've missed the opportunity for the prevention or the ultimate prevention. This is going to spread through our population, and now we have to mute that spread as much as possible and reduce the impact on the healthcare system. When that peak occurs is going to depend very much on how you behave, how your employees behave, and what we do as a society to limit that. We are not going to achieve what they did in Singapore and some of these other countries that have done so successfully, but we can certainly do better, and that's really everyone's job.
So one of the issues is we're all facing this is we see the numbers, and those numbers are the number of people that have identified as being infected or the number of people who have died, unfortunately, and very sad, obviously. But that's not really the real picture. What is the real picture? You've talked about this a little bit in other spaces.
Yeah, so that's a great point. It's the known and unknown, or those that have been tested that we can be certain of. And we've been very much behind the curve in this country in terms of the number of people that we're able to test, let alone test. Best guesses at this point are based on the number of people that we've identified by testing with a saliva test where we go scrape the back of your throat or your nose. That number needs to be multiplied perhaps by 20 to have some sense of the number of people that are actually carrying that infection. And importantly, they may be asymptomatic. In other words, they present with no symptoms, they're unaware of it. I think we've seen a number of videos from famous people who say, I feel fine. I think somebody said laces up, so he must have been a basketball player, but I can't tell you who he was. And he's got no symptoms, but he's a carrier, he's been tested. And that's really the issue. It's a lot larger than the number that we have today. And as I think about that from an employee standpoint, Fred, you're an expert on this. How do we address that as an employer and as an employee? What are you thinking about?
Well, the first thing I'm thinking about is the employers need to have a plan. They need to say to themselves, what are the risks that I face at my workplace for my business as well as for my employees? Who's coming to visit? How do my employees interact in the space? Have I created a safer environment? For example, putting up the simple stuff, hey, the hand sanitizers, things to wipe down your doorknobs, etc. And I think about this from the fact that when I was at my co-work office a week and a half ago, they really had turned to me and said, Fred, what are we supposed to do? And I said, well, have you thought about the fact that you have a break room in here? And everybody's going to the refrigerator or the coffee machine or the microwave, and they're touching that. And you have people sitting in certain places, and you have visitors coming in and out. So you need to begin to put those personal protective equipment for us, not the full masks and things, but the hand sanitizers, things scrub down, etc., and wipe down your tables and understand which biocides work, things like that. And then beyond that, begin to start thinking about, well, can we function with some of our work from home? Obviously, There are companies that can do that. It may be mandated, as it's been in a number of locales now. San Francisco, et cetera, where you really don't have a choice. So those businesses that don't have those kinds of functions are essentially shut down. And but for those that do have work functions, there are other ideas and things that they can do. Split the shifts so you have half as many people there. Maybe you run one in the day.
What a great idea.
Yeah.
Yeah.
Just like that.
Shifts, that whole shifting of time from a commute standpoint now suddenly seems like a really even smarter idea. Good news about all of the things that you were talking about in terms of surfaces, you've got to think about it. So you need some help. You need somebody to guide you through that. But the good news is some basic cleansing techniques actually work and are very effective, but you've got to do it. And you've got to think about when there's a reinfection opportunity, and you've got to take account of that as part of that process.
Correct. And obviously give employees, if they're ill, they need to understand clearly, don't show up at work. Stay at home. You have a cough, something's going on. Stay at home. Don't bring it in, and make it an environment where that's quite okay. It's understandable and expected versus, what do you mean you're not showing up at work? But those kinds of things need to be thought through. And then obviously you may have longer term shutdowns or things, and begin to address how you might do that. I think one of the clear things to do is any place that can figure it out, or as restaurants do, is move 100% to delivery. Get the stuff delivered out. And then obviously, as you've seen with places like Instacart and others, they've actually got a delivery selection that says, I'm not knocking on your door. I'm going to notify you at your door, and I'm going to leave it here.
Yeah, I think the overriding message I'd have at the end of this is, this is not we're going to return to what used to happen. That's never going to happen at this point. We are in a new phase of how we work. Will it be different? Yeah, absolutely. Will life carry on and things get better? Absolutely. I'm so confident about that, just based on some of the positive activities that people are contributing. But we've got to adapt to be able to survive in the new world order.
Right, absolutely. It's about changing and coming up with new ways to do your business, whether that's moving your home showings to 100% online, or other things like that, as a way to reach out to your target market, get them involved, and then be able to provide your services to them. Obviously more difficult in a manufacturing environment than a services delivery environment, but can be done.
Right. And to your point, brilliant suggestion, stagger those shifts so that you reduce that overall concentration of numbers. And sure, that's going to be difficult, but we're going to adapt. That's what we do as a human race.
Right. And the other thing I would just ask employers to focus on a little bit is the stress and anxiety that every one of us is going through.
Oh, amen.
This whole concept of looking at some of your mental health benefits, maybe bringing in other services. I noticed that some companies, for example, I think Headspace has announced they're free to clinical professionals for the remainder of the year or something. But giving people access to those services, and even considering what types of services or information you can give to the employees who now have to stay home because their kids are there, because school's been closed. And how do you reduce those children's stress?
Well, this has been a great discussion. We're going to have more of these. I'm excited to continue the discussion on COVID-19 and employers and employees.
Well, thanks so much, Nick. We enjoyed the heck out of it. Good time.
I'm Dr. Nick. I'm from Incremental Healthcare.
And I'm Fred Goldstein with Accountable Health.